Welcome to The Lost Debate, a show for political eclectics. I'm Ravi Gupta, and today I talked to Marty Makary, who is a surgeon and public policy researcher at Johns Hopkins University. He's a member of the National Academy of Science. He writes regularly for the Washington Post, New York Times, Wall Street Journal, but he also appears frequently also on right-wing media, like Megyn Kelly or Tucker Carlson or Fox News. So he is a bit of an eclectic himself. He's written 3 awesome books: Unaccountable, The Price We Pay, and most recently, Blind Spots, When Medicine Gets It Wrong and What It Means for Our Health. This is one of my favorite conversations that I've had in a while. I think it is going to make you think. I highly recommend reading the book after this, and you can, as you read it, especially if you're not super scientifically literate, you're going to have to stop every now and then to kind of gut check what it is you're reading, and you might not fully come out the other side fully proficient in everything he talks about. But I think his book probably raised more questions for me about sort of long held dogma I've had than any book I've read in a while. And when you listen to this interview, hopefully you'll understand why. So let's jump right in. Dr. Marty Makary, welcome to the podcast.
Good to see you, Robbie. Thanks for having me.
Well, okay. This is an interview I've had circled on the calendar for a while. It's just rare to read something that makes you think as much as Blind Spots has made me think. And so, first of all, I want to applaud you for this book. I think it's an absolutely riveting, incredible read.
Thank you.
And let's start at the place you probably least like to talk about. But I put my cards on the table as a guy who was probably like a go along to get along guy when it comes to COVID. I was just like, all right, I just listen to whatever people tell me. During a chunk of that period of time, I didn't have this podcast, so I wasn't like getting too into the evidence one way or another. It was towards the end of the pandemic that I started questioning things. And I remember reading testimony that you did to Congress and thinking to myself, this is kind of a turning point. Because if I remember correctly, you gave testimony and were lumped in together with anti-vaxxers, right? But as I read the testimony, you were pointing to evidence of myocarditis risk to younger men in particular. And there's the headline about things, which is like portrayed as like the anti-vax doctor. But when you read it, what you were saying, if I remember correctly, was, look, there's a risk of myocarditis. It's not a huge risk necessarily, but there's also not a huge benefit either, because these young people getting vaccines, young boys, are also not at significant risk of COVID death either. So I'm weighing these two risks against each other. And I remember thinking to myself, well, there's not just one camp and another when it comes to the science around vaccines and public health. Yet in the public square and in politics, it often feels that way. And so I want to start by just asking you, when you went through that period of time as somebody who's at Johns Hopkins and who's affiliated with, medicine, science, people with advanced degrees who, like me, happen to be mostly progressive Democrats who don't really like you going on places like Fox News and Tucker Carlson. Did you face like a massive backlash during that period of time?
Well, I'm glad you asked, because I guess I got hate from both sides depending on whatever I was saying. So the initial way I was pulled into COVID was I was editor-in-chief of the second largest trade publication of doctors. It's called MedPage Today. And I felt like I really needed to understand COVID. So before COVID really hit the United States, I called doctors in Wuhan, China, and I studied what was happening in Italy, and I talked to true experts. And I was convinced it was going to be bad and it was going to hit the US really hard. So I started sounding the alarm. Well, then, half the country hated me. This guy's fear mongering and he's overblowing it. And look at flu, and more people die of flu. So I became accustomed to the hate then. And then the vaccines came out. I argued that high-risk people should get vaccinated. And then the anti-vaxxers hated me. And then when the COVID boosters came out, the boosters made sense for high-risk individuals, but not for young, healthy people who had recovered from COVID. That was the nuance. And if you said anything that would challenge the vaccinate, boost for all message, then you got that label anti-vax. So I got it from both sides. And I think the lesson is that If you want to be nuanced, it can be a lonely place, but you've got to stick to the scientific process. The overall health benefit for a young, healthy male who had already recovered from COVID and had natural immunity was a net public health harm of vaccinating them. Thousands of cases of myocarditis that could have been avoided. And there were some other real tragedies, prolonged school closures. I talked till I was blue in the face. Fox News gave me a platform. I was grateful for it. And in the fall of 2020, we asked for schools to be reopened. And we talked about that incessantly. And to some degree, I feel like we lost and that kids lost because we were told there would be no harm, no downsides. And of course, now we're reeling in from that damage.
Yeah, and I think part of the challenge sometimes could be, and I don't want to talk about any one network or publication or whatever, is sometimes like there's like, oh, how do I get like this really important scientific and public health message out to as many people as possible, while also being like, well, okay, sometimes you're going to go on places where they're not using a rigorous scientific process to decide, they have their own agenda. And how do you like balance that, right? To say like, all right, like these people might have an agenda. Like if my process came out in a way that was like inconvenient to their politics, they might not invite me on. But I might as well just go on anyway. Like is that kind of your thesis? It's just like, look, like I get out there and I just speak to as many people as possible about what the truth as I see it that day is.
It's the latter. It's exactly that. I'll talk to anyone, and if I have the opportunity to encourage vaccination, I really don't care who the host is. I'm going to take advantage of that opportunity, and I'm going to say yes. So I did that a lot, and of course, people now in the modern world accuse you of crime by association. You know,
Yeah.
you were proximate to that person. Didn't matter that you may have disagreed or said something differently. But I think that's what's wrong with modern society is this kind of broad labeling. If we, for example, in healthcare, which is my real topic of interest, if we got away from all this back and forth hyperpolarization, there's so much we have in common when it comes to healthcare. We all want the same things. We all want to get corruption out of government when it comes to healthcare. So, and media is a very funny business, and I think the idea that there's unbiased and biased media is really hard to digest nowadays. I think there's so much, you saw it, well, not just with COVID, but weapons of mass destruction in Iraq. The whole world of corporate media just rah, rah, rah. Yes, thank you, Mr. Government. They told us from the government, so it must be true. Well, the government's also put out a lot of misinformation. I think they put out misinformation on COVID on certain topics, but I also think the biggest piece of misinformation the government has ever put out has been the food pyramid and a lot of other stuff. So it's good to challenge deeply held assumptions when there's no science behind it.
Yeah, and so much of what's in your book, I think there's a fairly large bipartisan consensus behind, especially when it comes to like the broader a broader conceptualization of what medicine should be, right? Your diet, exercise, sleep, and broadening that out. Like I've got so many medical professionals in my life. My father's a physician, my mom's a nurse. So many of my friends are in this world. The good news, as you point out, and I'm kind of cutting to the chase, but I want to bring us on the full journey, is like when it comes to hope, so many of the people entering medical school, so many of the people who are interested in medicine and science today, even older guys like my dad, are going to more conferences now and thinking more broadly about their work. Um, and so I think that's the good news. But let's actually, and I actually think there's a lot of consensus around that. Like whether you're a Democrat, Republican, Independent, uh, RFK supporter, Jill Stein supporter. Like, I think a lot of people agree on a lot more than we give them credit for. There's obviously certain like pretty significant areas of important disagreement, but that's also part of the process.
Yes. And the labeling is what's working against that, right? The labeling is doing a tremendous amount of damage. And we're seeing it now that people get news media that just affirms what they already suspect. And so that's why I like what you're doing, Robbie. I think it's an important service. I just out of curiosity, what kind of doc is your dad?
Well, he's an internist, but he has done the full journey. He's worked at emergency rooms in Harlem. He started a medical practice down in Alabama that he recently sold. That was a walk-in urgent care center. He does a weight loss practice that he still runs down there out of the same clinic. He's worked at, City MD.
Yeah.
It's actually hard to track exactly what it is. And what's interesting is he's also a Trump Republican, and I'm a Democratic operator. So we have like that back and forth too. And what's interesting is the medicine, like you'd think, given his politics and my politics, that are like we would have disagreements on medicine and science, but it just never comes up. Like I think we both have kind of met on common ground on that and have actually explored longevity science together. I run like a longevity and health kind of beta tested community with about 80 people right now, where I've been applying sort of principles that actually very in line with your book with my friends who are doing certain healthy practices and tracking certain biomarkers. And I've kind of helped design it alongside my dad. So it's actually been a huge opportunity for us to collaborate. Um,
That's cool.
but he's like he's been going to all these conferences, and he's the kind of guy who'll come back. He'd be like, "I heard David Sinclair," and then he'll be like a David Sinclair fan for like 6 months, and then I'll be like, "Hey, like I think he overstated metformin or whatever." And then my dad will actually shift off of his position. I'll be like, I know you're friends with Peter Attia. I'll be like, I got my dad a subscription to Peter Attia's website so he could read the show notes. And he's like, oh my God, if I ever had this when I was in medical school. So it's like he's evolving just like what I think a lot of the young people going into medical school who, really hold up a lot of these figures as the vanguard. So that's the hopeful side. But actually, Marty, let's actually take a step back and talk about some of the shenanigans here to put it lightly. Let's talk about peanut allergies to start, which is actually where you start in your book. Uh, Somewhere along the period of time when I was graduating high school, the turn of the century, which makes us sound old, uh, there was a significant change in the incidence of peanut allergies. Uh, talk to us about 1999.
Sure. Um, well, first of all, I love what you were saying because we don't learn a lot in medical school that we need to be learning. And so that really applies to all these topics I write about in the book Blind Spots, including the peanut allergy dogma in the year 2000 that parents should avoid peanut butter until a kid turns 3. No kid should be exposed to peanut butter or peanut products until age 3. That was the dogma. And because in 1999, there were some media stories about peanut allergies, even though peanut allergies were rare and they were often mild. And what happened was, or maybe you're going to ask me what happened. I don't want to jump in
No,
here.
no, keep going. Yeah, yeah. No, keep telling the story. Yeah, yeah.
so, so in the year 2000, the American Academy of Pediatrics thought, well, people are asking us about peanut allergies, even though they're rare and mild. So we feel like we need to tell them something to do to prevent peanut allergies. The problem is they didn't know. And so what they did is they created this recommendation out of thin air. They just made it up to say, well, you make sure kids are not around peanut butter or peanut products until they turn 3. So they forgot about a basic principle called immune tolerance, or the old dirt theory. And that is when you're exposed to things early in infancy as a young child, your body recognizes them and sees them not as foreign, but as part of yourself. And you're less likely to become allergic. So by encouraging peanut butter avoidance in the first 3 years of life, it ignited peanut allergies and it ignited the modern day peanut allergy epidemic. Peanut allergies skyrocketed immediately after that recommendation. And they thought, gosh, well, what's going on here? We need to double down. We need to get more compliance with our abstinence recommendation.
And make this, quantify this for us. So, what were we talking about pre 2000 in terms of peanut allergy incidents, and roughly where have we been over the past few years?
Yeah, it was it was about half of 1%, according to a Mount Sinai study. And most were mild. And it was probably related to changes in the microbiome, that is, to the bacteria that line the gut. And, so they were out there. But we started to see with this new dogma encouraging peanut butter abstinence a massive increase, including a new type of peanut allergy that became more common, and that is the severe anaphylactic reaction. Emergency rooms started seeing people come in who couldn't breathe. We saw these severe hypersensitivities where a kid would have trouble breathing just from being near a peanut. from being close to a peanut. And people mock that, but that's a real thing. I mean, that's very dangerous. And this started to surge in this 15-year period where the medical community was broadcasting peanut abstinence for young kids, and they were fueling this giant epidemic. And so finally, about 9 years ago, the study came out showing that they got it perfectly backwards. And by that point, it was too late for a lot of kids.
But, the study came out 9 years ago, but as you chart, there had been people ringing the alarm bell, along the way and pointing out, like, the sort of potential flaws in logic here. And also there were certain pioneers out there. You profile this guy named Stephen Combs in Johnson City, Tennessee, who was a pediatrician who had trained under this woman, Rebecca Buckley, at Duke. And it seemed like they had been extrapolating, and I may be mixing up their sort of data set, but there was like a sort of, the dirt theory as you talk about it. There was another analogy that you gave in the book by way of like piercing your ears with nickel. And they were basically extrapolating based on like other sort of scenarios to say like actually exposure could be the solution here, and it's actually the 1 2 3 underexposure, like the milk. I think first year, the recommendation of the AAP was milk in the first year, eggs in the second year, peanuts in the third year. That underexposure could actually be driving this. There were people raising these questions early on. No.
Yeah, exactly. Yeah, that was an amazing a couple. I met a couple amazing doctors, people who were I don't know what to call them, nonconformists or appropriately using the scientific method to say, wait a minute, this recommendation to just abstain from peanuts in the first 3 years of life is dogma. There's no science. As a matter of fact, the best science that we know about in immunology tells us the opposite. So, Stephen Combs, a doctor in rural Tennessee who was trained by that Dr. Buckley, he had no kids in his entire pediatrics practice develop peanut allergies over his career. And that's because he always encouraged early exposure of a little bit of peanut butter when a kid was in infancy. And I met some other remarkable doctors. Now, they were, sort of thought of as anti science and how dare you challenge the medical establishment. But really, they appropriately used independent thinking to say, look, if there's good evidence, I'm going to believe something. And if not, I'm going to use my best clinical judgment. The doctor in the UK, in London, who eventually did the study that proved the recommendation to be anti science and eventually reversed it, he had noticed that kids who had braces with metal as a young child were less likely to be allergic to the metal in an ear piercing. And so that concept of immune tolerance or the dirt theory was something he had observed right in front of his eyes. And he had spent time in an immunology lab. So it really drives home the message. Well, I wrote about this story for a couple reasons. Number one, we need civil discourse. We need to be able to challenge deeply held assumptions in the field that are not based on science. And number two, people need to know the truth about how to prevent peanut allergies and other allergies because the dogma was so ingrained, it still lives on to this day. I mean, to this day, the WIC program does not cover peanut butter for infants. And so that's why I tell these stories. It's not that I don't want to write a textbook of health because then it's boring.
It
But
also
if,
will be outdated. I'm sure at some point a lot of studies will come out that bring more nuance to everything you mentioned today,
yeah,
right?
yeah.
One thing
So,
that's also
yeah.
worth mentioning on Gideon Lack, I think, is the
Hmm.
gentleman from the UK, was that, correct me if I'm wrong, he pointed this out because the UK, I think, had issues with their recommendation before we did. In 1998, he pointed out that there were unintended effects, I think were his words, right? And he basically predicted an increase in incidents, and people didn't listen to him back then. I guess the question is why people are listening to this. And I think you're fair to physicians throughout the book. You're like, you're not saying that there's a cabal of people trying to conspire to make people less healthy. But the obvious question is why does stuff like this happen?
I think for a couple reasons. One is people fall for the labeling game. They engage in this sort of what we see now with partisanship, and that is, oh, they're one of those. And they don't actually listen to the merits of the argument. And you see it on both sides right now of the political spectrum. Number two is there's a lot of pride in these institutions, right? We can't, you see this theme in the book, we can't change our recommendation. People won't trust us if they see an inconsistency. Well, it's the opposite. People don't trust you if you are dug in and you're ignoring new data. And I think we saw a little bit of that during COVID. Public trust in doctors and hospitals is down in a recent JAMA study from 71% down to 40%.
That's a huge drop.
It's a huge drop. And so some people feel like they've been lied to when the data came out on natural immunity. Why not recognize that in the vaccine mandate? And like they did in other countries, they gave you credit for at least one dose sometimes. You didn't see that sort of adaptability. You saw this sort of ingraining in entrenched positions. And I think the most impressive reason, the third reason you see this pattern is something called cognitive dissonance or the founder's effect. The brain, the psychology of the human condition is to hold on to what we believe, not because it's most logical, but because we heard it first. And the first idea we hear, according to Dr. Leon Festinger, the scholar who created the term cognitive dissonance, he describes it as the ideas get comfortable in the brain. And if new information challenges that, now you've got internal conflict, you've got internal discomfort or dissonance, you've got cognitive dissonance. And the brain doesn't like that. So subconsciously, the human condition will go through acrobatics to dismiss new information just so they can hold on to what they originally believed, or reframe new information so that it's consistent with what you already believe. So imagine you're a smoker and a study shows smoking's bad for you. Well, the cognitive dissonance theory shows that what'll happen is you'll say, well, those are different people in the study, or I smoke with filtered cigarettes, or I don't smoke as long as they probably did in the study, or I work out and that should counterbalance it. And the brain will subconsciously go through all of these active efforts just to try to hold on to what we believe first. But that's the opposite of what we should be doing. We should
Yeah,
be actively suspending those biases.
it reminds me of a conversation I had the other day because I have been a lapsed vegetarian and vegan for a long time, and I was in an ethical debate with my friend the other day about factory farming, and I said to my friend, and my friend said to me, he's like, "Aren't you like eating meat now?" And I was like, "Yeah, but I'd rather be a hypocrite." But I still believe, like, I'd rather be a hypocrite than change my reasoning to align with my behavior and not the other way around. Because I think the only hope I have of aligning my behavior with like what I believe the truth to be, and I could be wrong about the truth, I have pretty strong feelings about it, but is like I'd rather be a hypocrite for longer than to change my rationale. Whereas I think for various periods of time, as I've been a lapsed vegan or vegetarian, I find myself being like, oh, maybe it isn't that bad. Maybe the factor, but really, what's going on is I'm trying to align my beliefs with my behavior. If that makes any sense. Uh, and so I think this is something that we face. But the question is like, okay, well, where are we now? Because I still, I'm a former educator. I used to be a school principal. The peanut issue is still alive and well. It's like, navigating EpiPens and peanut butter at lunch and on airplanes and all this kind of stuff it still feels like a code red.
I had two students from Africa come and work with me, and they're health professionals in Africa. And when they came here to JFK and then took the flight to Baltimore, they were just like, what is it with the peanut allergies here in America? And they basically told me there's no peanut allergies in Africa and in many parts of Europe and Southeast Asia because they never adopted this peanut abstinence dogma. So now that we have man, the the medical establishment basically ignited this modern epidemic. We've got all these kids with peanut allergies. So now you have two options. Just avoid peanuts altogether, which means other kids in your school need to avoid them in your classroom. At home means the younger kids in the household don't get exposed to peanut butter early. And that's I would say, the more economical route, maybe the easier route for some families. The more difficult route is going through the hard work of reintroducing small aliquots under the direction of a doctor. And now there's a new medication that was just approved in February of this year called Xolair, and that can help with managing the sort of reintroduction to treat peanut sensitivities. But it's hard work, and some people can't afford it. So we're reeling in from this problem. And unfortunately, a lot of schools have been forced to just ban peanut butter and peanuts altogether, which is a real tragedy because peanuts are a great source of protein. They're inexpensive. They've been used to address world hunger programs. So people need to be aware that peanut allergies are real. We shouldn't mock them, and that it's important to know. And to this day, I think many parents still do not know. You want to be introducing a little bit of peanut butter early in infancy.
Yeah, and the study, you talk about international comparisons. I think given how unique the US and the UK have been on this, it actually provided an opportunity to find the truth, right? It was some kind of Israeli baby food, for example, that it contained peanut butter that allowed for, I think, one of the first studies that I think was Lack or one of the others did to even unearth this in the first place. So it's kind of an astute observation, actually.
Yeah,
It's helpful that not the rest of the world wasn't following along.
that's
Um,
right.
well, okay, there are many different places we could go. There's uh, antibiotic resistance that you talk about. There's cesarean sections, et cetera. But I actually think your hormone replacement therapy chapter is a really fascinating case study here. Let's lay out the evidence here. And I think you point out that for most of the 20th century, hormone replacement therapy was pretty widely accepted and viewed as a bit of a like huge breakthrough, and was fairly, I know we probably hate the term consensus, but the consensus was that it was a fairly effective procedure for those who fit the sort of guidelines. And roughly the same period of time that the peanut allergy panic was happening, there was a really important study published in I think, the Journal of American Medicine. Tell us this story.
Yeah, so this was probably the biggest screw up of modern medicine. What happened was that for half a century or so, as you said, hormone therapy for perimenopausal women was considered a miracle. And we're talking about replacing the body's estrogen with estrogen when a woman stops producing it. And that's the perimenopausal period, estrogen plus or minus progesterone. And so, what we observed in several studies is women were living longer, they felt better. Hormone therapy had an incredible effect on blood vessels to make them healthier. And so, the rates of heart attacks went down in half among women who were on hormone therapy. The rates of cognitive decline were dramatically lower, up to 60% lower. And the risk of Alzheimer's went down by 35% among women on hormone replacement therapy if it started within 10 years of perimenopause. So there were all these benefits. Bones were stronger, less bone fractures and hip fractures, all of these tremendous benefits. And then 22 years ago, a doctor held a press conference, a doctor from the NIH, and declared that hormone therapy causes breast cancer. Immediately created tremendous fear. Women flushed their pills down the toilet. Doctors called their patients and told them, get off these things. And the irony is, the underlying data was never released at the time of that press conference. So the media had run with the story. Doctors just assumed it to be true. And finally, when the data was published in a medical journal, it turns out there was no statistically significant increase in breast cancer or breast cancer mortality in that group that took hormone replacement therapy. They had misrepresented the data. And I interviewed him for the book Blind Spots, and basically he acknowledged to me that there was no statistically significant increase in breast cancer mortality, but he just kind of believed in his gut that it did.
And there's some really wild procedure around all of this that we probably can't do justice to, but uh, you could read about in the book, listeners, just how this guy convened his co-authors, and I was actually so curious about this that I went to the summary of this JAMA paper because I was like, how would they publish something like this? And so I'm going to quote from you the way it is summarized right now. I think this is in the abstract. It says women on hormone replacement therapy with estrogen plus progestin showed a 26% increase of invasive breast cancer compared to those on placebo, hazard ratio of 1.26 with a 95% confidence interval of 1 to 1.59. So continues to be on this, like the abstract. that this is a statistically significant study. But as you point out, and sorry, listeners, if this is getting too technical, you point out, and I could use your help figuring out where these two data sets are coming from, where that abstract is pulling from, because you point out that that they have a confidence interval range of 0.83 to 1.92, which, as you point out, includes a one, which would be no statistical significance if I'm understanding this correctly, no effect.
That's right.
But obviously could have a huge range on the upside or downside depending on what's actually going on. But the fact that the range includes one means this is not statistically significant. Am I right about that? And what's the difference between those two data sets? How could those two things be true?
Well, first of all, you're 100% right. The statistical test applied, called an odds ratio, included the integer 1.0, which means non statistically significant. That's what it means. It's always meant that. It means that today, that's how we have science. That is the basis of statistical testing. And if we don't believe that, then, snake oil cures cancer and vaccines cause autism, and you can believe whatever you want out of data. So that's a fact. Now, the authors and the lead author I talked to said, or a couple of the lead authors I interviewed for the book said, oh, well, it approached statistical significance. And I said, that's not a thing. Like, I'm a researcher. I'm a Johns Hopkins researcher. I spend 90% of my time doing research. I've published 300 scientific articles in my career. I mean, that's not a thing. And so if it is a thing, then we don't have science anymore. And let's assume it was statistically significant. The other benefits far eclipse that risk that went from 4 per thousand to 5 per thousand women. That's what they described as the 26% increase that scared the shit out of all these women worldwide. And 50 million women since that announcement 22 years ago have been denied this incredible benefit of hormone replacement therapy. The vast majority of women who go through menopause around the time of menopause are great candidates. Not 100%, but the vast majority. And to this day, 70 to 80% of primary care doctors do not recommend or will not prescribe hormone therapy. And if you ask them why, they will tell you the 2002 Women's Health Initiative study found that it causes breast cancer. It's unbelievable. People need to know the truth. And so I did my own investigative journalism as a physician, and I wanted to tell this story so everybody in the world can learn about the details and the backstory. It turns out before that announcement, a bunch of doctors who were close to that researcher had said, you can't put this out there. There's no statistical significance. And if you create fear to women with something as sensitive as breast cancer, you will, quote unquote, never be able to put that genie back in the bottle. And that's where we are today.
And the basis of this, among other things, as you mentioned, is that estradiol, the sort of body's form of estrogen, is a vasodilator. So it improves circulation, which has all kinds of benefits, among other things. And there was reason to know this, obviously, which is why there was a 50-year plus sort of, again, like consensus slash momentum around the use of this, tracing back to this Mayo Clinic study where women's had their ovaries removed. And there were pretty dramatic effects of that, which I think you don't really like, this, there could be multiple volumes on this, but like essentially, is that the beginning of this, like this sort of period of time in which HRT was widely used? And if I understand the sort of body of evidence correctly, you had this many decades period of time in which that Mayo Clinic study and its progeny dominated. You had this flawed study in the middle of it, which led to the decreased use of it. But then you had a bunch of follow-up studies that confirmed the Mayo Clinic finding. Is that right? So basically you had this one blip in a sea of other evidence.
That's right. And it turns out the researcher had gone on record years prior in an article. I found that he had written, we have to stop the HRT bandwagon, he said. But the study wasn't done yet. So it's like he had made up his mind before the study was done. But yes, in 1953, researchers from the Mayo Clinic studied young women who had their ovaries removed in their 20s. And they all went on to develop early heart disease, including one woman who died of a heart attack at age 28. So what's going on there? Well, their ovaries make estradiol or estrogen, and that is cardioprotective. It helps keep the blood vessel walls soft. It increases nitric oxide, which is a miracle molecule that helps keep the blood vessel walls healthy and dilated. And so we had observed for a long time that when you remove a woman's ovaries, they have this massive acceleration of heart disease. And in another European study I found that was more recent, when women stopped taking hormone replacement therapy, their risk of heart attacks went up by nearly 25% in the year that they stopped it. So there's all these incredible data points and studies that point to all of these benefits. And really, this was one study that just shocked everybody. And so it's a tragedy because the study was also designed poorly. It started the hormone therapy way too late in life. And that's why in their particular study, they saw an increase in cardiovascular harm.
And as you point out in your book, a lot of the people involved in that study went on to be rewarded by the medical establishment. I think the key author was a Time person, 100 most influential of the year, and a bunch of those people went on to chair institutions and have all kinds of accolades. So it seems like the system, and I'm an institutionalist, which makes this really hard for me to say. The system seems to have rewarded this massive combination of incompetence and something much worse than incompetence.
Yeah. Well, I think, look, if people are, I don't want to create cynicism. If people are injured or in an accident and you go to a hospital, just do whatever the doctor says. Okay. Don't ask
Yeah,
questions.
this is important,
Right.
Marty. Please, because I don't want people, quote unquote, doing their own science in emergency situations
Yeah.
or in a lot of situations. I would kind of want to work with you what the answer here is, because obviously people can't be trying to rediscover penicillin in their basements, right? Like it's like you have to we have to have
Right.
some kind of you at a certain point there has to be some baseline level of trust mixed with some healthy amount of skepticism, and I want you to help us figure out what that equation is.
Yes, yes, and I think it's challenging, right? Because institutions are subject to groupthink, and we do see sometimes this pattern that when the medical establishment, when our priesthood uses good scientific evidence, we shine as a profession. We can help a lot of people, but when they rule by opinion and they issue strong edicts that are really just based on their gut feeling, we can do tremendous harm. Opioids are not addictive for 20 years. Kids should avoid peanuts until they turn 3 years of age, igniting the peanut allergy epidemic. These edicts have done tremendous harm. The food pyramid, tremendous harm. You could argue that the food pyramid ignited the modern day obesity epidemic, moving us to a refined carbohydrate, ultra processed diet. And I think one of the big blind spots of modern medicine has been gut health. But I think you're asking specifically about, what about the careers of all these people that got sort of elevated? It's amazing. The people who put out this information, I think, misrepresenting their data. And it was really a small group of leaders of the study, other members of that national study, which, by the way, this study that we're talking about, the study was announced in 2002, the Women's Health Initiative study, was the largest study ever done in the history of medicine, $1 billion taxpayer dollars. And so a lot of careers got promoted. Again, it was that cognitive dissonance. Well, we did this big study. This is what we said we found. We can't undo it. That would create mistrust and we have to be consistent. And so a lot of those researchers have dug in. As a matter of fact, one of them has on their website. She's now, I think, the vice president of a major medical center.
I
She,
honestly, this morning, Marty, had to double check that you were still at Johns Hopkins, because as I was reading about your background, I'm like, this can't be possible if this guy's still there. Like, I was like, how is he still over there with all this going on? So kudos to Johns Hopkins and you. I've always had a lot of respect. One of my favorite doctors in the country is this guy named Marshall Bolden, who, if you ever looking to check out a truly visionary guy, he's been on this podcast before. He started this company called Vigilant Health in Mississippi. He's a Johns Hopkins educated physician who also he met his wife there, and they married, moved down to Mississippi and started a group of clinics to treat diabetes and have now extended it out to treat Medicaid patients and self-insured patients, basically trying to practice long-term care medicine, like, basically preventative medicine and treat metabolic disorder through more than just traditional nuts and bolts medicine. Um, actual conversations about diet, sleep, health, lifestyle, happiness, and having tremendous results with some of the hardest to reach patients. So kudos to John Hopkins.
They've been great. They're terrific. I've been there a long time. I've got great relationships with the staff and administration. I think they know I'm dedicated to doing whatever I can to do things, properly with patient care and research. And I think when you earn that respect, then you're not some anonymous person on the internet that's easy to hurl, negative comments about it. And that's what we need in society, more civility. Um, but you're touching on something that's really big, Ravi, and that is the biggest blind spots of modern medicine are in the area of chronic diseases. Why have all these chronic diseases surged massively in our lifetime? They didn't exist, some of these things, or they were ultra rare just 2 generations ago. They're still rare in the Amish communities in the United States that eat off the soil and use good regenerative farming. Why is it that now 1 in 22 kids in California is diagnosed with autism, something that's increased by a rate of 14% each year for 23 years? Why are we seeing autoimmune diseases surge? Now it affects 1 in 5 women. Half of our nation's children are sick. They're obese or pre-diabetic or diabetic or overweight. Half. Are they bad kids? I mean, in Japan, it's like 3 to 5%, right? We've got to take a look at our blind spots and talk about our poison food supply, engineered chemicals that are added as ingredients in food, designed not to promote health, but to increase the shelf life and the economic value of food. I tend to see the best in people, and we told the food industry, increase the food supply. We have to address food insecurity. And so they did what we asked them to do in the 1940s and 50s. And we got all of these unintended consequences from pesticides, for example, which have hormonal dysregulation properties. The average age of puberty is going down by a week and a half every year now for 30 plus years. What's going on here? Is anyone working on this? And so we've got to look in our blind spots at the root causes of all of these major threats in society. The country is getting sicker. We talked about if you're in an emergency, do whatever the doctor says. We're great at hospitals at taking care of emergencies. We can do very sophisticated operations. But when it comes to the health of the public, American healthcare has been a 50-year failure. The population's getting sicker. The more antidepressants we prescribe, the more depressed people are. The more Ozempic we prescribe, the more obesity there is. The more pain medications we prescribe, the more pain there is. The more diabetes medications we prescribe, the more diabetes there is. What's going on here? It's not the medications causing these problems, it's that we're missing the boat. We're not talking about root causes, and we've got to start doing that. We're so busy in medicine, billing and coding. I think we've done a terrible thing to doctors. We've told them, put your head down, focus on billing and coding. We're going to measure you by your throughput. And we haven't given doctors the time or resources to talk about the root causes of all of these epidemic chronic diseases on the rise.
Yeah, you think about what is the experience of the average person with the medical system, right? Like when I would spend time with my dad in his urgent care center, which people use as primary care in this country, they come in and they're like, I have this thing. They come in with the problem, which is problem number one. They don't come in when there's no problem, right? That's actually when you want them, right? You want people to come in and not just for their quote unquote checkup, which is a joke in this country, right? You want to come in pretty regularly. You want to have a coach. You want to have somebody who's going to be like, all right, how are you sleeping? What are you eating? Are you stressed? Right? This should be part of medicine, right? And honestly, it would actually increase, there's massive depression. It's not an accident. Depression and rates of suicide in the medical profession. And I think in part because these people are only dealing with the end case here. They're dealing with a lot of death and destruction. They're also dealing with the mistrust that you're talking about. They're also, this would be a surprise to our audience, being underpaid often, because I think the view of physicians is that they're super rich and all this. But if you factor in all the years of medical education that they have to have and the deflation of the salaries in the profession, because you think of like the 1980s Porsche driving physician, that's not where we are anymore. It's actually a pretty rough profession, you know, and as some people have pointed out, it's kind of a blue collar profession. Like if you think about it, you're dealing with blood and guts, feces, and it's tactile, and you're out there in life. And we're not supporting the physicians, we're not supporting the patients. I'll get off my soapbox, Marty, but I think there needs to be a radical re-envision
No, you're
this
right.
whole profession.
100%. Look, we as doctors have the highest suicide rate. We have one of the highest burnout rates now. And it's not because we are working hard. We want to work hard. It's because we have lost autonomy. We have lost the ability to deal with the root causes of so many of these problems we see. And we're sort of put on this treadmill of corporate medicine, and it can be miserable. Now, there's a lot of great things that are happening in medicine, but where is the discussion of school lunch programs instead of just putting every kid on Ozempic? Maybe we need to treat more diabetes with cooking classes than just throwing insulin at everyone. Maybe we need to talk about sleep medicine more, something I learned nothing about in medical school, as a root cause of hypertension instead of just throwing antihypertensives at people. Maybe we need to talk about physical therapy and ice for back pain more than just surgery and opioids. We've got to talk about food as medicine, our poisoned food supply, the role of pesticides and heavy metals, toxins, seed oils, which are pro inflammatory. We have been increasing general body inflammation in the modern diet, and we're blaming kids. As we do all these things to kids, really poisoning their food supply, causing general body inflammation, we're blaming them. We're saying, oh, well, they're bad, they're lazy, they're disobedient, they're making poor choices. No, we've poisoned their food supply. How do you explain kids in other countries have much lower rates? And by the way, in those countries now where they're also poisoning their food supply, you're seeing those rates start to skyrocket as well.
And what's interesting is we could, if we keep all the great things about our medical system, right? The fact that you can have like a robot repair your knee or whatever. I'm just making it up. I don't know if that's true.
That's true.
Like,
Yeah.
like that's awesome. That's great. Let's keep all that stuff, but let's also get really good where everybody can have a coach, right? Everybody, you know, can walk in and have somebody who believes in them, who actually understands who they are and how they live their life well ahead of hopefully any issues. And then also, like you say, let's take a systemic look at all of these things that you're talking about. And actually, what's exciting is the chances for bipartisanship, nonpartisanship. When you talk like you talk, Marty, you could be on Democracy Now, or you could be on Tucker Carlson, right? Like actually, the distrust and the dissatisfaction around the system, whether it's the pharmaceutical industry or the food industry or the medical industry, is widespread on the left and the right. And that's a huge opportunity. Now, wading through that is going to be really hard because the damage is done now to the trust of the public. So, you know, when you talk about things like the autism risk and vaccines, all that, there's a lot to wade through, a lot to disentangle, a lot of distrust, and getting people on board with some of these solutions could be hard in certain cases, but a lot of them are non-controversial to the average person. The problem is there's a lot of money to be made and a lot of systemic inertia, which in some ways is maybe the biggest problem here, right? Just change in general is hard for a lot of people. Um, but where would you start? Would you start with the medical schools? Would you start with the media ecosystem? Like, where, if you were just to pick one institution to reform, which institution would you reform?
I would start by getting corruption out of government. We have so much corruption in our health agencies. Pharma has a hammerlock on a lot of the research enterprise in the United States. The NIH is supposed to fill in and fund important research that's not funded by the pharma industry, but they're not really doing that. If you look at what they're spending money on, it's very erratic. There's almost no money spent on nutrition. I interviewed for my book Blind Spots the head of the microbiome unit at the NIH. It's like one person. You know, it's like, why is this? This is like the most important central organ in health, is the microbiome. It's connected to the immune system, to mental illness. Some of those bacteria in the gut produce serotonin. They produce GLP-1, the active ingredient in Ozempic, naturally in low doses in the microbiome. They conjugate estrogen. They're involved in hormones. And here you have a central organ in health, an organ that we are screwing up with ultra processed foods and chemicals like pesticides. Humans are not Roundup ready like crops are genetically modified. So they're affecting our microbiome. What are these pesticides doing to the gut lining of all these bacteria? If they kill insects, what do you think they're doing to the millions of different bacteria that live in harmony in the gut? And so where's the research on this? And the NIH has been, I don't know what they're doing. It's very erratic what they're spending money on. I mean, obviously we learned during COVID, they were giving money to China to study bat coronaviruses. It's like, what are you doing? It's like a bunch of mad scientists. What are you doing? How about studying school lunch programs? Like these are the real issues facing Americans. They should not be partisan. And I mean, heck, Gavin Newsom just took an impressive step in banning 7 chemicals from school lunch programs. Well, they go by the cutesy name food dyes, but really these are chemicals that are engineered to either make foods look colorful or to do something else. And what's happening is when they go down the GI tract of a child, the body's immune system is reacting to these chemicals that do not appear in nature. And that reaction is not a big inflammatory storm. It's a low-grade, constant inflammation, and it's making kids feel sick. And the answer is not more medications. The answer is to deal with the root causes.
Yeah, I look behind your shoulder. You have Skittles, Doritos, and all that. Is that a prop, or is that actually your lunch today?
Yeah, my lunch is Skittles. No,
Yes.
it's actually a prop. I just bought these from England. And so what I've been doing is buying foods from Europe and comparing the food labels to the same foods made in the United States. So these are American companies. Take, for example, Kellogg makes Fruit Loops. It makes 2 versions, one for Canada, where a bunch of food dyes are banned, and another version for the United States where the colors are brighter and they have all these chemical food dyes. Now, we know food dyes have been associated with all these harms and chronic diseases and attention deficit disorder. Don't American kids deserve the healthier version of a food product of an American company? I mean, what's going on here? Right? So we need to increase awareness. So a bunch of us are going directly to the public. We're saying, look, don't try to label things politically. Don't say, oh, this is from the left or right. Just listen. We have got to stop poisoning our food supply. We've got to take a look at our environmental exposures that cause cancer, not just the chemo to treat it.
Well, Marty, I could talk to you for hours. This is an absolutely riveting conversation. For our audience, go out there and buy Blind Spots: When Medicine Gets It Wrong and What It Means for Health. There is also a newsletter and website that updates like scientific research on a regular basis, commentary.
I've got martymd.com. There's a bunch of good resources out there I'm trying to point people to. Foodbabe.com is a great one where you can learn about food and decisions. Casey'sKitchen.com. But I think a bunch of us now are trying to say, hey, we don't want to be on the treadmill in medicine. We don't want to just, be on this sort of hamster wheel of life. And we're trying to go directly to the public to educate them so they can make good choices and help us with our advocacy work.
All right, Marty. Well, thank you so much, my friend.
Thanks, Ravi. Good to see you. Thanks so much.
Well, thank you, everybody, for listening. Obviously, this may have prompted lots of questions and thoughts. 321-200-0570. I'm also getting a lot of feedback and great feedback about Lenore's episode yesterday. Keep sending those stories, feedback, ideas in from your parenting and from your schooling experience. Again, 321-200-0570. Talk soon.